Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Pooja from Apollo Cradle and
We
Children's
can't hear.
Hospital.
We can't hear you.
You can't hear me?
And
Not even now?
unmute.
Hello?
Me.
Hello, can you hear me?
We are not able to hear.
I can hear you properly.
Yeah, it's audible.
Okay, fine. Let's start the introduction again. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Pooja from Apollo Cradle and Children's Hospital. She is going to talk about PCOD management. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Yeah, thank you, Shivani. Hi everyone. I am Dr. Pooja Chaudhary, Senior Consultant, Obstetrician and Gynecologist at Apollo Cradle Royal, Chirag Enclave, New Delhi. Today we are talking about management, PCOD, and its management. So, what exactly is PCOD? So, PCOD is polycystic ovarian syndrome. It's a hormonal imbalance that affects women of reproductive age. This is the most common cause of missed periods, and it is characterized by multiple cysts in the ovaries. So these multiple cysts are actually, fluid-filled sacs which contain eggs. So the eggs are large in quantity, but the quality is not that good. So you find multiple cysts in the ovaries. You have irregular periods and high level of androgens, that is male hormones in the body. Exact cause of PCOD is not known, but it is influenced by a combination of environmental and genetic factors. Insulin resistance and hormonal imbalance may also play a role in a development of PCOD. Similarly, it is also considered a lifestyle disease. It's your lifestyle and your increased stress may also contribute to having developing a risk of high risk of PCOD. Now, symptoms of PCOD can, vary, but it commonly includes irregular menstrual cycles. Irregular menstrual cycles may, you can have, the periods may not come on time, and you may even have absent periods. There are patients, we have seen patients, where they're not getting periods for as long as 6 7 months. So that is one presentation of PCOD. Another extreme is that the patients are getting periods, but it is not stopping on its own. They can get periods every 15 20 days, and the periods are prolonged, it's heavy. So that's another spectrum of PCOD. So you can have both the presentation in a PCOD patient. So another other thing is acne. There might be problems of acne. बहुत ज़्यादा breakouts, pimples बहुत ज़्यादा बढ़ जाते हैं. Hirsutism, that is excessive hair growth, especially in the you can have facial hair बहुत ज़्यादा है, या near the breast the hair growth ज़्यादा है. So these are other symptoms of PCOD. Apart from that, patient may also complain of hair loss, excessive hair loss. So that's another spectrum, another symptom of PCOD. Some patients complain of weight gain, कि obesity है, weight gain बहुत ज़्यादा हो रहा है, and they are not able to lose weight. So even they are doing exercises and everything, so they are not able to lose weight at with so much of exercise and diet reduction also, but that's becoming a problem, and the weight is continuously increasing, and they are on the higher side of the weight. So that is another problem associated with PCOD. As we said, the cycles become irregular, so sometimes in these patients conception may also become a problem. Conception in the sense they may not be able to conceive easily, and those who do conceive they have higher risk of miscarriages and medical complications during pregnancy. So it's not that all PCOD patients will land up with medical complications or miscarriages, but they in comparison to other normal pregnant patients, they have a higher tendency of miscarriage and pregnancy loss. And uh, uh, and the risk of medical complications like diabetes and blood pressure also increases during pregnancy in a PCOD patient. Uh, Sometimes, and as we said, it's a lifestyle disease, so it can also lead to long-term health complications like diabetes, high blood pressure, and because of this, there might be a chance of heart disease also later on. Sometimes, the risk of uterine cancer also increases, especially in those patients who are not getting periods, who are skipping periods for as long as 6 months, 7 months. They are not getting periods and they are not taking any treatment. In those patients, the risk of uterine cancer also increases. So it is very essential that a patient should get at least 3 to 4 periods in a year to reduce the risk of uterine cancer. And all of these, because of the facial hair and irregular cycles, obesity, patients may have psychological symptoms, they may have poor self-esteem, and they may go into depression also. Coming to the diagnosis of PCOD, so diagnosis of PCOD involves a combination of medical history, physical examination, evaluation, laboratory tests. In some patients, ultrasound may also be done to see the cysts in the ovaries and also to see the lining of the uterus, endometrial line. That's called the endometrial thickness. So that gives us an idea about the uh, whether the patient falls into the category of PCOD or not. So along with a laboratory test and along with the medical history, and we can put classify a patient whether she is a PCOD patient or not, depending upon these factors. Coming to the treatment and management, so aim is basically to reduce the risk of complications and to manage the symptoms. There is no permanent cure for PCOD. You cannot cure PCOD, but you can control the symptoms. Symptoms can be controlled by your diet, exercise, and medications if required. So the common approaches, the treatment, the specific treatment plan may depend, may vary depending on individual to individual. क्या प्रॉब्लम है, पेशेंट का प्रॉब्लम क्या है, so targeted approach, we can look towards a targeted approach, what the patient symptoms, patient is presenting to us with the symptoms, and what is the goal they want to achieve, whether it's just to regularize the cycles, या acne की problem है, या facial hair की problem है, या they want to achieve pregnancy. So the treatment can be tailor made for each patient, and it may be different for each patient. But the common approaches that includes lifestyle modifications है, जैसे you have to maintain a very healthy diet, and a regular exercise. Healthy diet means आप healthy diet खाओ, junk is to avoided, quit smoking, alcohol if you're having, because they all lead to irregular cycles, because alcohol से weight gain भी होता है, so they may add on to our problems. We also recommend regular exercises. It can be, you can do anything you want, it can be yoga, aerobics, dance, but you should be consistent with the exercise. It is recommended that you do at least 30 minutes of moderate intensity exercise, at least 5 to 7, 5 times a week, so that will take care of your this physical activity. So weight loss as less than it's 5%, even if you lose 5% weight of your total weight, so that goes a long way in treating PCOD. I mean, and if you continue to do your regular exercise and diet, maintain your diet, you may not require any treatment also later on. You can just maintain a healthy lifestyle and you will be symptoms free. Sometimes, medications may have to be given to regulate your menstrual cycles, control acne, and reduce excessive hair loss. PCOD patients may conceive on their own. Some patients may require fertility treatments. So कुछ patients ऐसे होते हैं, हम थोड़ा सा fertility treatment देते हैं along with exercise and diet, and they conceive very easily and deliver a healthy baby. But there are certain patients who may require further treatment, and some patients may also need an IVF, if all other treatments fail. So that depends on patient to patient. So it is better the early you consult the gynecologist, the better it is, for them to treat you. You can gain, you have time also. The age is also a factor. So there's so many factors that limits, so many things that matters fertility. So the earlier, if you know that your cycles are irregular, and that, few years down the lane, you're like 1 2 years down the lane, you are planning for pregnancy, it is better that you consult your gynecologist at that stage only, so that, those 2 years can be utilized for, regularizing your menstrual cycles, your PCOD, your metabolic syndrome, everything, so that when you're actually planning to conceive, things are under control and you can conceive naturally. And sometimes, rarely, when everything fails, so sometimes we may have to do a surgery called ovarian drilling to reduce the number of cysts, but that is rarely done nowadays. So we, want that patients should come at an early stage, so that we have time in hand, we can treat them, and evaluate them, and treat them thoroughly, so that we have a good outcome at the end of the treatment. Simultaneously, as we said, because it's a lifestyle disease, it also causes metabolic syndrome. So patients need to keep a regular check on their blood sugar, blood pressure, lipid profile. So they should, do it every. The lipid profile is actually cholesterol. So they should, keep a check on that, and consult their doctors regularly. They should be in touch with their doctors regularly. So finally, so it's, as we I think you've understood what I want to convey to you. So it is important for women with PCOD to regularly visit their gynecologist for the monitoring and the management of symptoms. With proper treatment and lifestyle changes, many women with PCOD are able to manage their symptoms and lead healthy lives. So our aim here is to, spread awareness, so that we can together easily fight this disease. Thank you. So any questions? Okay, so there are no questions, right? Yeah. So thank you all for this thing. I hope this will help you, and you would maintain a healthy lifestyle, and together, so that we can, uh, d- reduce the disease burden of PCOD. Thank you.